Let us start again. So, good afternoon, everyone, and this is the series of our the best cancer awareness program. And today's our speaker is Dr. Harsha Agarwal. Dr. Uh, Dr. Harsha is a doctorate in psychology, specializing in health, clinical, and child psychopathology. She has been leading the psycho-oncology department at Rajiv Gandhi Cancer Institute and Research Center since 2018. She is dedicated to fostering an open ecosystem for cancer patients and caregivers to address emotional, psychological, and behavioral challenges. A globally recognized expert in mental health, Dr. Agrawal holds certification in career counseling, suicide prevention, behavior analysis, and psychological assessments. Her impactful research and contributions to awareness have been widely published, honored with numerous awards, including the World Best 40 under the 14 at BE Healthcare Summit 2024 and Dr. APJ Abdul Kalam Award 2023. She continued to excel in psychology. Dr. Saharsa, it is up to you.
Thank you so much, Dr. Birendra, for such a warm welcome. I would like to request sir to kindly share my slides. And thank you for giving me this opportunity to spread more awareness about mental health, importance of mental health among breast cancer patients, and sending a message that prioritizing your own mental health and yourself is as important as prioritizing the physical health. We all prioritize our physical health, but not the mental health. So let's learn few things about mental health, majorly about stress and how everybody is stressful in our day-to-day life and how stress impacts the mental health of breast cancer patients and survivors and how we can deal it in the best possible manner. Can we have slides up, please? Through today's topic of stress management and mental health for breast cancer patients and survivors, through this webinar, we will be focusing both on physical and emotional aspects of our patients through this webinar. This webinar will provide some valuable insights to all about the emotional landscape and promoting mental well-being of the patients and the caregivers as well. Now, the first thing is how we understand the impact of breast cancer on mental well-being. Now, why understanding the impact of breast cancer on mental well-being is important because it has few different aspects. First is the emotional distress, second comes the cognitive change, and third is the physical impact. Now, these impacts are via different phases and stages. When I'm talking about emotional distress, whenever a patient is being diagnosed with breast cancer and they get to know that they have to undergo treatment, it triggers a range of emotions in a patient, including, and not only patients I'm also talking about their caregivers as well. There is a fear, there is a lot of anxiety and sadness, there is anger, even guilt at times come up in patients and attendants as well. The patient is under fear of disease because disease in itself, as in cancer, is equals to death. Whether even after so many years of research, even after so many years of um, publications, researches which are coming up, there are so n number of our Bollywood actors, Hollywood actors who are coming up with the treatment and they are sharing their experiences still. We still till date relate cancer to death only. We relate cancer to the death sentence. If you are diagnosed with cancer without considering what stage it is, without considering whether your diagnosis has a treatment or not, we only relate it to death. So there is a very innate, huge fear related to it, which anyhow triggers the anxiety of now what will happen? What will happen to me? What will happen to my family? What will happen with me? Whether I'll be able to take the treatment or not, whether treatment is going to be successful on me or not, which ultimately leads to a huge amount of negative effect. And I, in myself as a patient, goes into sadness. Either I'll be sad about it or I'll get anger. I will have anger issues because I'm unable to cope up with my own emotions. I'm unable to handle my own emotions. So I express it in a manner as frustration and anger. Or a patient may also get into guilt. Have I done something wrong? Is it a result of my own karma? Why? Why this has happened to me? Why me? Why only me? No one in my family has ever got it. Then why I have got it? Have I done something wrong to somebody? Have I thought of something wrong, doing something wrong to somebody? Or is it a result of my past your life, my past life? We don't know. But I am feeling guilty or I am regretful about even as small as minuscule thing I could have done, which I do not even remember. So understanding the emotional roller coaster is very crucial in coping up with breast cancer and stabilizing the mental health of a patient. Which now, this is the emotional distress which any patient or any individual will go through and their family will go through with just the diagnosis. Next comes the cognitive changes. When you, as a patient and a family, as a caregiver, have decided to go on with the treatment. Now, patients may experience changes in their thinking pattern, such as difficulty in concentrating, forgetfulness, and decision making challenges. Why I focus only on these three? Because I am continuously focusing on my treatment or my disease. I am more focused on fetching more and more information about my disease, fetching more and more information about how, for example, let's say chemotherapy works. What are the side effects of chemotherapy? How chemotherapy is going to help me or is going to harm me out, for example. Or even if as a treatment, surgery has been suggested to me, how surgery is going to leave a scar on me, whether I'll be able to handle myself or not, how people are going to see me, how people are going to talk about me. So I am because I am very analytically focusing on n number of things. Thus, my other analytical and cognitive abilities, such as concentration, remembering the things, and making quick decisions, are compromised. And without focusing on this point, that because I am preoccupied with something, thus I'm unable to do this, I very conveniently put it on my treatment, that it is the result of my treatment why this is happening to me instead of me being preoccupied. Because as it is, I am though as a patient not doing anything. It is all what doctors are doing, it is all what treatment is happening to me, and thus it is happening to me, which will further lead to physical impacts. The physical side effects of treatment undoubtedly are there, such as fatigue, pain, changes in body image can significantly impact the mental well-being as well. No one is saying that there are not going to be physical changes. Yes, certainly they are going to be there. But if I am concentrating more on the impacts which are going to harm me, which are making me feel less of me, which are going to make me less of what I have been throughout, then they are going to harm my mental well being more than just taking them as a part of my treatment. Yes, it is needed. It is not forced on me. It is needed. It is a part of my journey. I have to undergo such a procedure. For example, let's say mastectomy, or for example, let's say breast conservation surgery. It is just a part of my treatment so that the disease can be removed out of me, disease can be taken out of me. or even if I have to undergo chemotherapy and there'll be hair fall. So hair fall is going to be a part of a treatment. It does not mean that hair fall is going to be permanent. So it is not going to be a permanent change. These are temporary changes. Apart from the changes produced by surgery, no other change is going to be a permanent change. Next slide, please. Now, as we were talking about psychological impact of breast cancer, we were talking about how mental well-being is going to be compromised. The first thing here comes up as anxiety and depression. The uncertainty and the challenges associated with the diagnosis, here we are talking about breast cancer, can actually lead to increased anxiety and depression. Why and how? These conditions can impact daily life and overall quality of life. Everybody knows that whenever we are anxious, whenever we are depressed, our quality of life is compromised. We are unable to enjoy our day-to-day routine. We are unable to perform as good as we used to be. But why? Why anxiety and depression? Because there is a huge amount of uncertainty which causes negative effect. And I, being today's generation, focuses more on Dr. Google than my treating doctor. So whatever I am facing, I am going on Google and searching on everything, right? I am not saying Google is saying everything which is wrong, but Google is not answering your questions specifically to you. Are they actually applicable on you? We don't know. Neither we want to know about it, but we automatically believes on whatever I see. Instead of blindfoldedly believing on things, at least whatever questions you have, whatever things which are straining you, whatever things which are making you more worried about yourself, whatever things which are making you feel bad about yourself, whichever are making you go slow, write them down, ask your doctors about the same. Whatever they will suggest is pertinent to you, pertinent to your diagnosis, pertinent to your treatment only. Because every medication, every type of surgery, why that is needed for you, why the doctor has chosen that for you, only they know. And the side effects which they will have or you will incur, only they can explain you in a better manner. You can talk to the treating team, you can talk to the psychologist or psycho-oncologist available in the uh, super specialized hospitals in whichever you are going. Do talk to them and have more clarification instead of just believing on everything whichever you're facing. But certainly, having anxiety and depression is not abnormal. Anybody who is going or who will or who has to undergo the diagnosis may have anxiety and depression. For example, in psychology, according to DSM, we do have a certain criteria of diagnosing depression. But with just the diagnosis of cancer, it can be with the blink of an eye that you are diagnosed, you may be diagnosed or you may show all signs and symptoms of MDD. So you do not know that whether you are going to have depression or not, or with this, psychologist is not going to wait for 4 to 6 weeks to see whether symptoms are persisting or not. But you can be diagnosed with depression with just the diagnosis as well. Or you, at times, the diagnosis of depression and anxiety are also intermingled. At times, patients are showing the symptoms of anxiety, but because everybody is now using these two terminology, anxiety and depression, just like that. So, if people are constantly talking or telling a person because you're not eating well, because you're not talking well, so you're depressed. No, it is not depression. It can be that I am trying to adjust with my diagnosis. It can be that I am trying to sink in the information. Thus, I'm not speaking of that well. So, it is not depression. Let it be diagnosed by a psycho-oncologist or a clinical psychologist or a psychiatrist. Then only consider that you have it. Then the trauma. Anyone who is been diagnosed with cancer, yes, the term in itself, the disease in itself is traumatic. The hearing the word that yes, you have cancer leads to a huge trauma, leading which may lead to PTSD as well. Because in why PTSD? A trauma can be left there only. You may need not to go up to the PTSD if it is treated after being acknowledged at the right time. Point is, we do not acknowledge the fact, we do not give due importance to the fact that yes, I have got trauma of knowing that I have got cancer. I need to acknowledge the fact that yes, this is one trauma, this is one state where I have to give due importance as well. I start getting on treatment. I start looking for doctors. I start looking for any number of situations where what kind of treatment should be given, whether I should go for surgery or should go for chemotherapy or should go for radiation therapy, or what all kind of treatment are available. I may go to n number of doctors, but I do not go to a psychologist to understand, to take this diagnosis rightly in me. I just unacknowledge this fact that I should first accept that I have it. I have seen a number of patients who have almost are half done with their treatment, who have undergone the surgeries as well, but they have not accepted that they had cancer. They may accept that I had a cyst, I had tumor, but that tumor was cancer? No. So at times people are half done, or at times people are done with their treatment, considering that they were just being treated for a tumor, but they do not want to even listen that it was a cancer. Thus, such patients, when realize that they are undergoing a cancer treatment, leads to post-traumatic stress disorder. Why? Because their trauma was unacknowledged and left untreated as well. Then body image concerns. This psychological impact of body image concerns among breast cancer patients is very huge. Because for women, we relate our breast to our womanhood. For us, having breast is womanhood. So, any scarring can significantly impact the body image and self-esteem of a woman, leading to feelings of shame and embarrassment. When I say shame and embarrassment, why? Because as I said that for women, breasts are their womanhood. They consider being more women. They consider themselves being beautiful when they have it. But when a doctor suggests that you have to undergo mastectomy where one or both of your breasts have to be removed, they consider no, it is not socially acceptable. How will people consider me? What will people look at me? How will they see me? What will they talk about me? So for them, society matters the most than themselves. So for such females, this body image concern is really huge. Even nowadays, we have breast conservation surgery, we have reconstructive surgeries as well. Still, having that scar on their body, at times, I have heard from patients that now I am not the same how God has made me. भगवान ने मुझे जैसा बनाया था आफ्टर सर्जरी तो मैं वैसा रहा नहीं, तो मैं उसके पास जाऊंगा कैसे या जाऊंगी कैसे? It is not like that. So these are few things which I have heard on daily basis. So yes, they the confidence level reduces like anything. The self-esteem of facing people, the self-esteem about them, their own self. They're not motivated enough for a working, let's say for a working woman, they're not motivated enough to now work outside their home. They more prefer having work from home kind of stuff, but they do not feel confidence enough to go out and still work. Can we have next slide, please? Now, common psychological challenges and stresses faced by such patients are: one are treatment side effects, as we have talked about, hair fall. Few are nausea, vomiting, fatigue, pain. They're also there, and which actually affects the daily life of a patient. When I am feeling constantly, I am feeling fatigued. When constantly I am feeling nauseous, whenever anybody is talking even about food. When I am in pain, then I am unable to do my daily chores as well. But the point is why I am in these pain, why I am fatigued constantly, because I am taking my treatment. But what I have to do in my treatment, I don't know that. I don't know my own role. Point is that the psychological challenge here is I am more focusing again on my treatment and my disease. Rather, as a patient, I should be focusing on what I can do to help my oncologist and help my treatment to work best on me. I do not focus on what are my efforts. Rather, I am focusing more on because let's say I am on chemotherapy. So जैसे जैसे chemotherapy अंदर जाएगा मेरे को nausea होगा. मुझे खाना तो खाना ही नहीं है. खाना देखते ही मुझे vomit आती है. But rather I have to make an effort कि मैं हर थोड़ी देर में खाऊं, थोड़ा खाऊं, frequently खाऊं so that मेरी body के अंदर जो अच्छे cells भी जा रहे हैं disease cell के साथ साथ वो regenerate हो. I do not focus on that. I do not focus on my safety. I do not focus on my hygiene. I do not focus on my sleeping pattern. If I'm not sleeping at night, I am sleeping throughout the day. So I am doing what? I'm replacing 6 hours sleep with 18 hours of sleep, but I'm not getting the satisfaction also. I'm still having that complaint that I'm not sleeping well. But I should be actually focusing on what my role is in it. Certainly, treatment side effects are there, but I, as a patient, can do any number of things to come out of those side effects. Financial concerns are there. Now, financial concerns actually hold a lot of relevance because undoubtedly the treatment is expensive. Medical bills and loss of income can actually create a financial strain because at times patients are the one who are bread earners of the family as well. So, undeniably, when there are financial concerns, it does make a huge impact. There are now, next is relationship challenges. Now, relationship challenges, as I'm not confident enough about my own self as a patient, the breast cancer can actually strain my relationship with my partner, with my spouse, with my family members, and friends. I am not confident enough to communicate well, socially as well. I'm not confident enough to ask for support, even if it is a very crucial to get a support. I rather feel that no one is going to help me out, or I am becoming a burden. So I should not be burdening more on my, let's say, family members, as now I do not have breast of one of my or I have scars on my body, my partner is not going to support me. Rather than seeing that they are one who are actually, see, family members or spouse are going to be there. Usually they are there, right? I'm not denying of the fact that in certain cases situations do happen when there are some conflicts, but conflicts does happen even when you do not have disease as well. No relationships are perfect to the core, but we try to make them perfect. We try to solve the issues rather than building upon our own thought process and perceiving that because this is happening, thus this has happened. We don't talk about the issues. Then there's a huge fear of recurrence. Even after treatment, the fear of cancer returning can create ongoing anxiety and stress. Why? Because constantly I'm thinking about disease. एक बार तो हो गया, दोबारा हो गया तो फिर से आ गया तो ये तो आता ही है. जितने भी मैंने पेशेंट से पूछा उनको रेकरेंस हुआ ही है, मुझे भी हो ही जाएगा. बट हाउ आर यू जनरलाइजिंग इट एंड व्हाई आर यू जनरलाइजिंग इट? This is a stressor. The next point is why? Why am I stressing myself? Who is given me in written or on a stamp paper and signed it that yes, it is going to return back. Yes, my partner has a problem with my with me post my mastectomy. Yes, treatment is expensive. Yes, I am utilizing my resources. I am utilizing my finances, but I cannot have any support system. Yes, treatment has side effects, but my disease does has a treatment. Who has given you, you as a patient, who has given you this on a stamp paper, written and stamped? and sign that yes, these things are gonna happen and they are irreversible. You are going to get the recurrence and it is certain. No one. But I ascertain it to myself. Get my brain trigger this to my DNA to produce such cells again in my body. So I hope my listeners do have some knowledge about psychoneuroimmunology. So that is the brain which triggers my immune system to produce certain cells. Now, the importance of stress management and producing better treatment outcomes. So here, it is like improved immune function. The stress management works with improving the immune function. Managing stress can strengthen the immune system, helping the body fight off infections and recover the treatment. For recovering the treatment, you actually need strong immune system. But with the treatment, your immune system remains compromised. But as a patient, if you put in strong efforts in optimizing the stress level without giving or taking too much of negative effect, when you start your balancing the stress and anxiety and start giving some positive energy to yourself, you will certainly strengthen your immune system functioning, which is going to fight with the disease and will help you in recovering early. Reduce side effects. Certainly, when you have a good stress management techniques, you know how to manage it in the right level. You do have reduced side effects because you're able to manage your own self. You know what is to be done. If you are feeling weak, you know that you have to balance it out by increasing the intake in small quantities, but by increasing the frequency, ultimately you are increasing the complete nutritional intake by hydrating yourself, by maintaining physical exercises, by making yourself active. I'm not asking you to run during your treatment, but at least walking for 5 minutes post every meal you are having can help you in better results and recovery. It will enhance the quality of life by reducing stress and improving emotional well being. Patients can experience a better quality of life throughout the treatment and recovery. Quality of life. We all focus on quantity of life. Sir, इससे मेरी there is one question which usually our oncologist faces. सर ये डायग्नोसिस तो हो गया, लाइफ कितनी है? नो वन कैन टेल यू लाइफ कितनी है, बट दे कैन certainly add good quality of life. Everybody has this right to have good quality. There is one dialogue of Anand movie of Rajesh Khanna, बाबू मशाई लाइफ लंबी नहीं बड़ी होनी चाहिए, which says कि whatever quantity of life you have, you should have good quality there instead of having good quantity of life without having good quality. तो वो रैंक रैंक के जीने से अच्छा है जितना जियो खुलकर जियो, खुश होकर जियो. So if we are having, for example, I'll take the example of fever. फीवर एक ऐसी चीज है जो किसी को भी होता है और सबको होता है. हम ट्रीटमेंट लेते समय फीवर का कभी ये नहीं सोचते मुझे दोबारा फीवर आएगा या नहीं, ये फीवर ठीक होने में कितना टाइम लेगा. कई बार वो फीवर लंबा भी चलता है. लेट्स से टाइफाइड, लेट्स से मलेरिया, लेट्स से डेंगू, ये सारे टाइप्स ऑफ फीवर आते हैं. अगर हम कोविड में भी देखें तो सबसे पहला सिम्टम जो नोट हो रहा था वो फीवर ही आ रहा था. सो वी हैव डिफरेंट टाइप्स ऑफ फीवर अवेलेबल. डरते नहीं हम उनसे. और ऐसा नहीं है लाइफ में फीवर एक ही बार होता है. Everybody, most of us, I would say, not even if not everybody, are immunized for typhoid medication, for malaria medication, for smallpox, for chickenpox. पर क्या हमें नहीं हुआ है? It's just that after taking treatment, we are better in dealing with the symptoms. In the same manner, जब फीवर आता है मेडिकेशन ले लेते हैं, ठीक हो जाते हैं और we do not focus much on it. क्यों? क्योंकि हमें कॉन्फिडेंस है जो हमने मेडिसिन लिया है वो ठीक कर देगा हमें, है ना. तो हमें ऐसे ही क्वालिटी ऑफ लाइफ को बढ़ाने के लिए उस ट्रीटमेंट पे फोकस करना है. हाँ, ये जो ट्रीटमेंट है ये मेरे अच्छे के लिए है. अभी पेनफुल हो सकता है बट मेरा ट्रीटमेंट तो है ना. लेट मी फोकस ऑन व्हाट गुड आई कैन डू इन दिस रादर देन कितने दिन जीना है. दिन तो बहुत है, जितने हैं जीत तो ले हम. improved adherence to treatment. Once you start having that confidence in your treatment, once you start having the confidence in your own self that yes, you can deal it in the right possible manner, तब आपका ट्रीटमेंट से एडहेरेंस भी बढ़ जाता है. एडहेरेंस का मतलब हो गया आप अपना ट्रीटमेंट कराना चाहते हैं, फिर अपने ट्रीटमेंट में डिले नहीं करते, अपने ट्रीटमेंट को टाइम टू टाइम लेते हैं, अपने आप को सेफ रखने की कोशिश करते हैं. कभी भी सपोर्टिव केयर की नीड आती है तो आप डॉक्टर के पास जाते हैं, बताते हैं कि मेरे को ये तकलीफ हो रही है. पर सिर्फ तब जब आपको पूरी नॉलेज होती है, जब आपको पता है कि डॉक्टर ने जब मुझे डिस्चार्ज करा तो उसने बोला कॉन्स्टिपेशन होगा तो क्या करना है, आपको लूज मोशन हो रहा है तो क्या करना है, आपको वॉमिटिंग हो रहा है तो क्या करना है. अगर इतने पे नहीं रुक रहा है तो वापस आना है इमरजेंसी में. और मैं उस इंस्ट्रक्शन को फॉलो करके वापस जाती हूँ हॉस्पिटल में. अगर मुझे नोजिया हो रहा है तो मैं वापस जाती हूँ डॉक्टर के पास. नेक्स्ट स्लाइड प्लीज.
डॉक्टर
बेटा हाँ
डॉक्टर
जी
अग्रवाल,
सर.
आ, एक क्वेश्चन आया है आपसे, मतलब नेक्स्ट पिछली स्लाइड से रिलेटेड कि आपने तो बहुत सारे पेशेंट्स को देखते हैं, डेली देखते हैं, उनका थिंकिंग
जी,
के बेसिस पे कितना मैटर करता है उनका थिंकिंग,
तो उनका
मतलब
थिंकिंग बहुत मैटर करता है. सो व्हाट आई परसीव हियर इज व्हाट माय ब्रेन इज जनरेटिंग टू माय बॉडी. अगर मैंने ये परसीव कर लिया या मैंने ये थिंक कर लिया है कि ये भाई कुछ भी कर लो, मुझे कैंसर हो गया, ये सारा ट्रीटमेंट ट्रीटमेंट देना सब झोल झपाटा है, मुझे कुछ असर नहीं करेगा लेट्स से, तो मैं कितना ही अच्छे से अच्छा बेस्ट पॉसिबल, और अगर मेरा क्योरेटिव ट्रीटमेंट भी है तब भी वो मेरी बॉडी, मेरा ब्रेन मेरी बॉडी को एक्सेप्ट करने ही नहीं देगा. वहीं देयर आर एन नंबर ऑफ पेशेंट्स जो हमारे लेट्स से पैलिएटिव केयर पेशेंट्स भी हैं, they are having good quality of life, they are having good quantity of life also, they are enjoying their life also only because they know that they have treatment and they are on treatment, they are doing good, they do take good care of themselves, they do follow all the instructions, they come from time to time, they make an effort to feel good, they make an effort कि अगर उन्हें किसी भी चीज से कोई भी लेट्स से परेशानी आ रही है तो आके यहाँ पर जैसे मुझसे भी बात करते हैं, अपनी प्रॉब्लम सारी डिस्कस करते हैं. देन एट टाइम्स दे कम अप विद सम क्वेश्चंस व्हिच आर नॉट रिलेटेड टू साइकोलॉजिकल इम्पैक्ट, बट आई डायरेक्ट देम टू द राइट पर्सन कि इस चीज के लिए आप इन पर जाइए. फॉर एग्जाम्पल वन थिंग विच एवरीबडी गेट्स टू फोकस ऑन इज न्यूट्रिशन. जैसे हम भारत में हैं, हम सबको लगता है अगर बीमार है तो फ्रूट खा लो, बेहतर महसूस करोगे. बट कई बार हमें कीमोथेरेपी के साथ फ्रूट्स नहीं खाना, कच्चा नहीं खाना, हमें रॉ नहीं खाना लेट्स से, राइट. कुछ कीमोथेरेपीज में होता है हमें कुछ समय के लिए रॉ नहीं खाना है. अब उनको इस चीज का होता है अगर हम फ्रूट्स नहीं खा रहे हैं तो हम बेहतर कैसे होंगे, हम तो रिकवर ही नहीं कर सकते. कुछ को होता है कि नहीं जैसे कीमोथेरेपी लग रहा है तो ये पेनफुल होगा ही होगा, कोई पेन नहीं हो रहा होता, कुछ नहीं हो रहा होता, मैंने असेस करा है, सब करा है, फिर भी उनको सिर्फ दे कंप्लेन अबाउट पेन. व्हाई? बिकॉज दे हैव हर्ड ऑफ इट एंड दे आर जनरेटिंग इट. दैट इज साइकोसोमैटिक पेन, दैट इज नॉट फिजिकल और ऑर्गेनिक पेन.
डॉक्टर एक अनदर क्वेश्चन है कि जो फैमिली मेंबर हैं उनके जो या कोई भी जो देखभाल कर रहा है पेशेंट को, वो खुद को तनावग्रस्त किए बिना पेशेंट कैंसर पेशेंट की मानसिक जो भी थिंकिंग है उसको कैसे समर्थन दे सकता है या उसके ट्रीटमेंट में कैसे समर्थन दे सकता है, क्योंकि जो भी फैमिली मेंबर है या उसके आसपास लोग आ रहे हैं उनका बहुत रोल होता है पेशेंट के थिंकिंग को प्रभावित करने में. यदि कोई पेशेंट बीमार है और बार बार कोई आके पूछ रहा है अब कैसे हो अब कैसे हो, कहीं ना कहीं वो पेशेंट को बार बार इम्फेसाइज करते हैं कि वो अपने डिजीज के बारे में सोचे. बट यदि कोई आके पॉजिटिव बातें करता है कि आप बहुत अच्छे हो, आप ठीक हो जाओगे, तो ऐसा कुछ तो वो जो है वो डिफरेंट थिंकिंग पे तरफ डाइवर्ट करता है पेशेंट. तो मतलब एक क्वेश्चन आया कि देख जो भी उसके देखभाल करता है या जो भी टेक केयर है वो खुद को बिना स्ट्रेस लिए कैसे जो है कि हेल्प आउट कर सकता है पेशेंट.
सर सबसे पहले इस क्वेश्चन में आंसर आता है फॉर द केयर गिवर, राइट. केयर गिवर
या
हमें सपोर्ट तब कर पाएगा एज अ पेशेंट, अगर मैं पेशेंट हूँ मुझे सिर्फ तब सपोर्ट कर पाएगा जब उसे खुद को कॉन्फिडेंस है, जब वो खुद पॉजिटिव है. अगर वो खुद डरा हुआ है ना चीजों को लेके, वो खुद अपनी चीजें डिस्कस नहीं कर रहा, अपनी सिचुएशंस डिस्कस नहीं कर रहा, उसके अंदर जो चल रहा है वो उसको लेकर अनसेटल्ड है, तो मुझे वो कॉन्फिडेंस इंस्टिल नहीं कर पाएगा। तो फर्स्ट केयर गिवर शुड बी साइको एडुकेटेड। उसको खुद को एक्सेप्ट करना पड़ेगा। अगर उसको कोई प्रॉब्लम फील हो रहा है, उसको भी स्ट्रेस हो रहा है, वो भी एन नंबर ऑफ सिचुएशंस में है, तो जाके डिस्कस करो साइकोलॉजिस्ट के साथ। नहीं करना साइकोलॉजिस्ट के साथ बिकॉज ऑफ द स्टिग्मा अटैच, अब अपने फैमिली मेंबर्स के साथ डिस्कस करो। अपने आप को सिर्फ बर्डन करने से फायदा नहीं है। अगर बर्डन भी है तो उसे शेयर करो बाकी फैमिली मेंबर्स में, तभी आप उसे कॉन्फिडेंस अपने पेशेंट को दे पाओगे। क्यों? क्योंकि आप रिलीव्ड हैं। नेक्स्ट कम्स अप इज, जब मेरे पास बहुत सारे लोग आते हैं, मेरे सो कॉल्ड सिग्निफिकेंट अदर्स आते हैं मुझसे पूछना आप कैसे हो, एज अ पेशेंट, एज अ केयर गिवर अगर पूछ रहे हैं आप अब आपकी मम्मी, आपकी बहन, आपकी भाभी, आपकी बीवी कैसी हैं, राइट? इफ आई हैव दैट कॉन्फिडेंस, मैं भी ये कहूंगा शी इज डूइंग गुड, ट्रीटमेंट चल रहा है, बहुत बढ़िया है। वहीं अगर मैं ये कहता हूँ अरे क्या कैसी है, ट्रीटमेंट चल रहा है, डॉक्टर कुछ ना कुछ करते रहते हैं, कभी ये हो रहा है, कभी वो हो रहा है, कुछ पता ही नहीं चल रहा क्या होगा क्या नहीं होगा, दैट इन इटसेल्फ मीन्स कि भाई मेरे को खुद को कॉन्फिडेंस नहीं है, मुझे खुद को श्योरिटी नहीं है, तो मैं सामने पेशेंट को कैसे इंस्टिल करूंगा? सो द पॉइंट इज सीकिंग सिंपैथी। मैं चाहता हूं कोई मुझसे पूछे, मैं चाहता हूं कोई मुझसे बोले, तो मैं बस फूट दूं अपने अंदर की चीजें, राइट? उनसे आपको कोई हेल्प नहीं होगी, बट अगर आप सही इंसान से बात करोगे इस बारे में, अक्नॉलेजिंग दैट यस यू नीड टू टॉक अबाउट, तब आप रिजॉल्व होकर कॉन्फिडेंटली आगे बढ़ सकते हैं, जिसमें आप ना पेशेंट को स्ट्रेन कर रहे हैं ना खुद को स्ट्रेन कर रहे हैं। नोइंग द राइट थिंग्स अबाउट द डिजीज, अबाउट द ट्रीटमेंट इज इम्पोर्टेंट। नोइंग दैट यस यू नीड हेल्प इज इम्पोर्टेंट। तो अपने अंदर जो चल रहा है उसे डिस्कस करने के लिए प्लीज साइकोलॉजिस्ट के साथ एक सेशन तो जरूर लें। एक सेशन क्यों जरूरी है? क्योंकि वो आपको जज करने के लिए नहीं बैठे हैं। आप, सबसे बड़ा फैक्टर होता है जजिंग। हम क्यों बात नहीं करना चाहते? सामने वाला जज कर लेगा मुझे, अरे मैं ऐसा सोचता हूँ। साइकोलॉजिस्ट डू नॉट जज यू, वो आपको आपकी प्रॉब्लम से रिलेटेड आंसर देते हैं एंड दे रिजॉल्व इट। तो अगर हमें अपने पेशेंट को बर्डन करे बगैर उनको रिजॉल्व रखना है, तो अपनी प्रॉब्लम्स को एक्सेप्ट करना है, सिंपैथी नहीं लेना है। कोई सिंपैथी देके आपको कुछ नहीं हो जाएगा। इंस्टेड अगर आप एक को आंसर करेंगे दैट यस माय सो कॉल्ड सिग्निफिकेंट अदर इज डूइंग गुड विद द ट्रीटमेंट, तो वो चार को जाके बोलेगा, तो 40 आपसे आके नहीं पूछेंगे कैसा है, अरे ओहो कैंसर हो गया, नो बडी इज गोइंग टू आस्क दैट, रादर अरे फलाना की सो कॉल्ड को देखा, उसका ट्रीटमेंट कितना बढ़िया चल रहा है, उसको देखो, उससे बात करो। यू बिकम एन एग्जाम्पल, जिससे जब सामने से कोई आएगा तो पूछेगा अरे आप तो बहुत बढ़िया लग रहे हैं, कैसा चल रहा है सब, और बढ़िया है। कभी वो ये नहीं पूछेगा ओहो अब आप कैसे हो, कोई दिक्कत तकलीफ तो नहीं है, नहीं, वो ये पूछेंगे और सब बढ़िया है, और बताओ कैसे बढ़िया कर रखा है। और ये होता है
सो
मेरे पेशेंट के साथ, बहुत होता है।
नहीं, एक क्वेश्चन और आया मेरे
हाँ
दिमाग में
जी।
है कि
हाँ
बीइंग ए
जी।
डॉक्टर पेशेंट्स आपके पास जाते हैं, तो क्या
हाँ
आपसे भी
जी।
हाइड करते हैं वो, या झिझक करते हैं सारी चीजें बताने में? वेरी वेरी आर आस्किंग
बिल्कुल सर,
क्वेश्चन।
बिल्कुल करते हैं ऐसा। देयर आर टाइम्स व्हेन पेशेंट्स और अटेंडेंट्स आर नॉट रेडी टू डिस्कस थिंग्स, एंड दैट्स ऑब्वियस। मैं भी किसी के पास जाके पहली बार में शायद मुझे उतना ट्रस्ट नहीं आएगा ना कि मैं उनके ऊपर सब चीजें बता दूं, उनकी सब चीजें शेयर कर लूं। इसलिए हाँ झिझक होती है। फर्स्ट सेशन इज, दैट इज हम फर्स्ट सेशन जो रखते हैं वो रैपो फॉर्मेशन का रखते हैं, साइको एजुकेशन का रखते हैं, सो दैट हम उनके साथ, पेशेंट के साथ, केयर गिवर के साथ एक रैपो फॉर्म कर रहे हैं, एक ट्रस्ट बिल्डिंग स्टेप करा है हमने, उनको एडुकेट करा है कि क्या क्या चीजें होने वाली हैं, क्या क्या चीजें कैसे होंगी, आपका क्या रोल है, आपको क्या क्या चीजें करनी है, कब डॉक्टर को बताना है, कब नर्सिंग स्टाफ को बताना है, आप और किस तक रीच कर सकते हैं। वंस दे गेट कॉन्फिडेंस, तो एक पेशेंट और अटेंडेंट वो चीजें भी सर हमें बता देता है जो उस सबने ऑन्कोलॉजिस्ट को नहीं बताई होती। पहले पर झिझक जरूर करते हैं, ये होता है, ये नॉर्मल है। और ये किसी भी ह्यूमन बीइंग के साथ होता है, इट्स नॉर्मल विद थॉट कि भाई सामने वाला तो जज कर रहा है ना मुझे, क्या मैं बोलूं? फॉर एग्जाम्पल बहुत सारे लेट्स से अभी कल का या परसों का ही केस है. वन ऑफ माय पेशेंट हु हैज टू स्टार्ट ऑन कीमोथेरेपी, फीमेल पेशेंट, ब्रेस्ट कैंसर ओनली. शी हैड दिस क्वेश्चन वेदर आई कैन बी इंटीमेट विद माय पार्टनर और नॉट. उसने बहुत झिझकते हुए पूछा, बट हाँ उसने पूछा. एट द एंड ऑफ माय सेशन पूछा. एट द एंड ऑफ ऑलमोस्ट एन आवर सेशन उसने पूछा, बट पूछा. तो यस, झिझक के पूछा पर पूछा. और भी उसके फिर क्वेश्चन थे. जब आज मैं उसका सेशन लिया तो शी केम अप विद अदर क्वेश्चंस आल्सो व्हिच वर क्वाइट प्राइवेट. बट यस, पेशेंस डज कम अप.
Okay, please continue.
So when we are talking about effective stress reduction techniques, there are few things. For example, mindfulness, meditation, progressive muscle relaxation, deep breathing exercises. अभी मैं इनमें से अगर बहुत ज्यादा हम डिटेल में जाते हैं तो बहुत सारी हो जाती है इसमें. बट माइंडफुलनेस को अगर हम बहुत छोटे में समझे तो एक छोटी सी चीज होती है दैट you have to be focused on something wherever you are. जहां आप हैं, जब आप हैं, वहां पर उस समय उसी चीज पे फोकस कीजिए. और एक न्यू हैबिट बनाइए टू बी माइंडफुल इन योर चॉइसेस रादर देन ऑन डूइंग थिंग्स. बी देयर. सिर्फ करते जाने में फोकस नहीं करना, हमें होकर करना है. तब हम उस चीज को बहुत समझदारी से करते हैं. तभी हम कोई भी ऐसी गलत फहमी या गलत चीजों को अपनाते नहीं है जो मुझे स्ट्रेस कर दे. सेकेंड इज मेडिटेशन. मेडिटेशन इज स्टार्ट फ्रॉम ब्रीदिंग प्रैक्टिसेस एंड इट्स मोर ऑन द फोकस थिंग. मेजरली जो मैंने अपने यहाँ पर पेशेंट से अपनाया है, देर आर टू थिंग्स विच एक्चुअली वर्क गुड ऑन एनी काइंड ऑफ कैंसर पेशेंट. इज one is focused breathing and another is body scan. And these two are working way too good with every kind of my patient. Focused breathing is one kind of meditation जिसमें जिससे जो कि सबसे lightest form of meditation है. Only you need to focus on your own self, on your own breathing pattern, and all kind of anxieties and stress in your body which are creating negative effects and negative energy in you, which are creating energy blocks in you, are resolved just by focusing on your breathing pattern. Another is body scan. It is more or less that you are focusing on your body from tip to toe and you're channelizing the energy in your body through which you opens up all the energy blocks which are causing pain, which are creating unnecessary malaise or fatigue in you, and which are not letting you consume right amount of food and have good amount of sleep also. Another one which we focus on is being active. So progressive muscle relaxation, when I'm talking about progressive muscle relaxation, this technique involves tensioning and relaxing different muscles of your body and also releases physical tension and promotes relaxation. So for example, stretching the hands, right? Stretching the legs, fingers, legs, joints, right? Your neck, tensioning and relaxing it, your shoulders. So, figuring different parts of your body, focusing on that particular muscle, tensioning it and relaxing it helps in releasing the energy blocks as well. Next slide, please. The role of support system is huge. A support system when I'm talking about is social support groups, family and friends, and therapists and counselors. Support groups are such people basically who once were at your stage as patient or caregivers and now have chosen to be volunteers to help and reach out to the new and current patients and caregivers who are undergoing this journey. They've already passed. So connecting with them actually helps a patient and the caregiver to talk about more freely about the problems they are facing because considering they have already gone through the same. So they relate to them, they try to resolve their problems through them. Next comes family and friends. So leaning on loved ones or for emotional support, practical help and companionship is essential for navigating challenges of breast cancer. Why? Because when I feel that I'm loved, I'm still being loved. People are there who actually are there for me, who are my support system. There is no change in my loved ones, in my friends. My family still sees me the same. Uh, then the what society and what outside my own, let's say, significant others or my safe circle does not really matter to me. And if still things are making you worried, things are making you stressed, try to reach to the therapist and counselor, because professional guidance from therapies or counselors can provide a safe space to process emotions, develop coping strategies, and manage the stress in the most efficient manner. It is not wrong to feel bad. It is okay to feel bad. Even I, as a psychologist, being in this field since last 15 years, I at times also feel sad on my personal front, let's say, because I am a human first, then a whatever I am. Everybody is first a human, then whatever they are. So it's okay to feel bad, but it is not okay to suppress it. Share it, express it, try to resolve it, try to find a solution to the same. If you're not able to find it through support groups, not through family and friends, do not follow the stigma attached to the mental health. Oh, if I go to a psychologist, it will be like, am I mad or what? No, you're not mad. It is normal to talk to a psychologist, talk to a counselor about your problem and find a solution. You should focus on finding a solution rather than focusing on the stigma which is attached. Though post COVID, the stigma has been reduced a lot, but you still need to focus on your own mental health to come out of it. Next slide, please.
डॉक्टर वर्षा, हियर
हाँ जी।
सपोर्ट ग्रुप्स का मतलब क्या है कि जो सेम मीन्स पेशेंट्स के ग्रुप और जो है कि किसका ग्रुप है, थोड़ा सा आप इलोबरेट करेंगे सपोर्ट ग्रुप का मतलब।
राइट सर, सपोर्ट ग्रुप्स का मतलब होता है कि वो पेशेंट और वो लेट्स से केयर गिवर्स जो इस जर्नी में थे कभी, जो खुद भी कभी पेशेंट्स थे, और आज वो अपनी सर्वाइवरशिप, एक्चुअली मैं उन्हें सर्वाइवर नहीं, मैं उन्हें वॉरियर कहती हूँ, जो आज वॉरियर्स हैं, हु हैव ऑलरेडी वन देयर फाइट एंड नाउ दे आर वॉलंटियरिंग टू सपोर्ट सच पेशेंट्स जो जैसे वो कभी थे. So, for example, we have breast cancer support group, we have lymphoma support group, we have Indian Cancer Society, we have Can Kids, we have support group for osteosarcoma, we have kidney cancer support group, we have neuro-onco support group. So, we have n number of patients who have gone through their journey in this, and now they're coming up to motivate, to share their experience with other patients and their caregivers as well, so that whatever questions these current patients are having, if they have gone through in their time, they do share. And there is a kind of instant vibe meeting with such patients, because when I see कि अरे कुछ साल पहले मैं भी इस बेड पे ऐसे ही लेटी थी, आज देखो मैं कहाँ खड़ी हूँ. So the instant question or the instant response to that is, क्या आप भी पेशेंट थे सच में? आपको देख के लगता नहीं है. So I have n number of females who are warrior of breast cancer, who are champions, and yes, they are coming up for the treatment. And last week or in the starting of, let's say, starting or ending of October, we had this breast cancer support group activity in our hospital, and we have performed for all the breast cancer survivors, and they participated very well in the complete event. They performed, doctors performed for them, they performed to thank the doctors as well. Everybody was coming up. Such people who are really enthusiastic really works for the patients who are coming up also, the new patients. So these people actually come into the category of support group.
और कोई पेशेंट है, मान लो ही इज नॉट एसोसिएटेड विद योर हॉस्पिटल एंड वांट टू मीट विद सम सपोर्ट, देन हाउ, कैसे वो मिलेगा? इवन आपका
तो
पेशेंट नहीं
पेशेंट
हो।
हाँ, So still, for example, let's say we have CanKids and we have Indian Cancer Society, right? So
Yeah.
they are universal things, right? They are bodies which are external to RGCI, but they are registered there, and these volunteers who are ever are registered with Indian Cancer Society, let's say, or Can Support or Can Kids, let's say, right? They
Yeah.
can visit to the dedicated hospitals, to all hospitals to which they are attached to. For example, Indian Cancer Society is attached to any number of hospitals. If this volunteer who has not been a part of Rajiv Gandhi for their treatment, but is a part of Indian Cancer Society volunteers, he or she can come up and join the team of the volunteers of Rajiv Gandhi as well. We have
Okay.
philanthropy department here. So every volunteer is whosoever volunteer is coming up, even if they are registered with Indian Cancer Society, they are registered with us as well. And we do take, as psychologists, we do take part in training them as well. Personally, I also give them training for their better
Oh,
communication, how they have to deal with the patient.
okay. Thank you.
Now,
Next
self-care
slide.
strategies for patients and survivors. Now, first is prioritizing sleep. Next is healthy diet, regular exercise, spend time in nature. I have put in here just four. There are n number of things, but focusing, if you start focusing on these four, prioritizing sleep. Now, when I say prioritizing sleep, I do not mean रात को नहीं सोया तो दिन भर सो लो कोई नहीं क्योंकि नींद को अहमियत देनी है नहीं इसका मतलब है दिन भर अपने आप को ऐसे व्यस्त रखें कि रात को आप अच्छे तरीके से सो पाएं you can actually recharge your energy levels. So before sleep, before you're going to sleep, let's say if you have to go to sleep at 10, 10 बजे से 1 घंटा पहले से आप अपना स्क्रीन टाइम जीरो कर दीजिए उस टाइम को हाफ एन आवर एटलीस्ट अपने फैमिली के साथ कंस्ट्रक्टिव कम्युनिकेशन में यूज कीजिए हाफ एन आवर अपने आप का दिन रेट्रोस्पेक्ट करने में कंज्यूम कीजिए खुद को सेल्फ एसर्टिवनेस दीजिए सेल्फ एसर्शन दीजिए 10 सेल्फ एसर्शन एटलीस्ट अबाउट व्हाट यू हैव डन हाउ यू हैव डन व्हाट थिंग्स आर गुड व्हेन थिंग्स वर बैड व्हाट यू कैन डू टुमारो टू मेक इट बेटर सो दैट यू कैन स्लीप बेटर एज वेल बिकॉज जितना नेगेटिव था आपने रेट्रोस्पेक्ट करते हुए सब यहाँ से एग्जिट कर दिया नाउ व्हेन यू आर गिविंग योरसेल्फ सेल्फ एसर्शन यू क्लोज दिस डोर एंड जनरेट पॉजिटिव इन यू which actually enables with the good sleep. Healthy diet is really, really important. One must consume well nutritious food. So last slide only. Nutritious food to support physical and mental health. Regular exercise is really important to keep yourself physically active and releases endorphins that have mood boosting effects. Even moderate exercise can make a difference, but getting yourself active is important instead of being lazy considering I'm a patient I should not do this I should not do that you may have do's and don'ts list but we do not only focus on don'ts see what you can as well spend time in nature so if you cannot spend time otherwise in nature and you are not able to do good amount of exercises what you can do is go for a walk in natural environment then in a gym or then in on a treadmill at your home. Go in a natural environment to feel good because that helps in regenerating yourself. You can also get involved into gardening. Maybe if you're a patient who is on treatment, may not be actively involved into gardening, but you can let the gardener do the things on your demand, which will also help you relax yourself and get a better feel about your own self. Next slide, please. Navigating emotional journey, which is coping strategies and resilience building. So one is journaling. Express. As I throughout my talk, I have been telling express your stress. Do not suppress it. Do not hold it back. Keep expressing yourself. So journaling. If you do not find anybody else, journal it. Writing down your thoughts and feelings can be powerful way to process emotions and gain more clarity. At times, if you're writing whatever you're feeling is too much negative, instead of making it or writing down it in a diary, take few sheets of paper, even if it is 20, 40 pages, write it down whatever you're feeling without rereading it. Once you're done, take those sheets and tear them off and burn them up. It will release all the negative energy from you. But the point here to be taken care is do not reread whatever you have written, even if you are writing the same point n number of times. Do not reread it. Next is positive self-talk. Self-assertions really help to challenge the negative thoughts with positive affirmation. Remind yourself of your own strength and resilience is really important to help in coping up with the journey you are in. Then gratitude practice. Nowadays, we do not practice gratitude too often, but focusing on the good things in your life can actually shift your perspective and improve your mood. For example, I do focus on I have got disease, but I do not focus on what if I have a disease, but I had no treatment. I still am on treatment. Can get better. I do not focus on getting better. Rather, I'm focusing on, or I got cancer. It's okay if you have got cancer, but you still are on treatment. It is still much better than this situation. Still much better than you may have had something for which there wasn't any treatment, or you could not reach up for the treatment as well. So you are in a better place. At least be thankful of that. Then setting realistic goals. Do not consider that if you are on treatment, you are not going to have any kind of side effects. Side effects will be there, but you yourself can make an effort to manage them in the most efficient manner and manage the side effects in the best possible manner. So breaking down big goals into smaller ones, achievable steps can a person to feel a sense of accomplishment and progress. For example, post chemotherapy, many patients complain, I cannot eat anything. I always feel nauseous. I always feel to puke out, right? So for such patients, I usually ask the first question is, जब कीमोथेरेपी चल रहा था आपने कुछ खाया पिया था ठीक से? नहीं मैडम दवाई चल रही थी ना, दवाई के बाद ही तो लेते हैं. मैं कहा दवाई मुंह से थोड़ी जा रही थी, वो तो आपके पिघलेंगे ये पोट से जा रही थी. Why have you not eaten enough? Why have you compromised then? अब खाली पेट में अगर दवाई गया है तो उसका साइड इफेक्ट तो आएंगे ज्यादा, बिकॉज एसिड फ्लो कर जाता है, राइट? तो आपको उसको सेटल डाउन करने के लिए काम करना है. अब तो हम दवाई से कर रहे हैं, बट फ्रॉम नाउ ऑन स्टार्ट पुटिंग इन एफर्ट. चाहे आप वॉमिट हो, लेकिन स्टार्ट ईटिंग समथिंग और अदर इन स्मॉल अमाउंट, so that this your body is stabilizing with medication also, and once the regulation is there, then only you can get better. Next slide. Self-care strategies for patients and survivors. Conclusion. Now, prioritizing mental health for holistic recovery. Now, remember that taking care of your mental health is just as important as taking care of your physical health. We do focus on अरे चोट लग गई, but we do not focus on यहाँ पर कितनी चोट लग रही है. अंदर ही अंदर मेरे खुद के गलत सोचने से, गलत चीजों पे बिलीव करने से, किसी के भी गलत व्यवहार से, एंड मैं ये तो सोचना भूल ही जाती हूँ कि मेरे को उस इंसान पे फोकस करना है जिसको मैं सुबह सुबह उठ के सबसे पहले शीशे में देखती हूँ. मैं उस शीशे में ना किसी और को देखती हूँ, ना अपने पति को देखती हूँ, ना बच्चों को देखती हूँ, ना माँ बाप को देखती हूँ. उसमें सिर्फ मेरे को खुद दिखता है. मुझे कोई सोसाइटी नहीं दिखती उस शीशे में, मैं खुद दिखती हूँ. तो अपने आप पे फोकस करके अपनी रिकवरी पे ध्यान दीजिए. By using the strategies as I have discussed in the webinar, you can navigate the emotional journey of breast cancer with greater strength, resilience, and well-being. Thank you so much for hearing me. Over to you, Birendra sir.
Yeah. Thank you, Dr. Harsha, and it was very informative. And I would like, we have a lot of questions, but due to the time, I'm not able to ask you, Dr. Harsha. But maybe I will connect you separately for the question and give the answer to the audience. So
Sure, sir.
thank you all for being a wonderful audience today. and your presence and engagement made this session truly impactful. And I would like to give the special thanks to Dr. Harsha for sharing the invaluable expertise and insights, and your dedication for advancing to treat the cancer patients is truly inspiring. And we are grateful for the knowledge and inspiration you have provided. So together, let's continue to drive the positive change in the important field with the positive thinking, as the Dr. Harsha told. And again, I would like to thank Dr. Harsha for being with us, and we hope that you will be with us to support the patients through the BBIF Cancer Care in future as well. Thank you, Dr.
Thank you for
Harsha.
the opportunity, sir. Thank you.
Thank you.